The Department of Psychiatry and Behavioral Health at Geisinger grew in the last multiple years since 2017 to serve the needs of the community. Geisinger has invested a huge amount of resources and a skill set and recruitment effort to really be able to serve a large area and up to 23 counties. All of them happen to be, one way or another, in a shortage area from a mental health perspective. So Geisinger has heavily invested in mental health, and as a department, we have been trying to deliver on that promise of providing the best care for our patients in our catchment areas and as soon as possible, and to serve the community the way it deserves to be served.
We're really fortunate, being a rural system, to have a full continuum of care. We have services on the inpatient side with brand new facilities, 96-bed inpatient facilities, consult service, outpatient, and integrated care. So for a rural setting, for us to have all those services is really unique.
So some of the options that we have here at Geisinger are in-person services, where traditional, you'd walk into an office, you'd be checked in, and you'd see your behavioral health specialist that way. Or we have options that relate to the telehealth world. Some locations have carts where patients are physically in the office, they get put on a monitor, and they interact with their provider directly over the video. Or sometimes we have the video from home, where the provider could be in another state, for instance, and the patient just gets to stay in the comfort of their own home.
Boy, we just have a huge workforce shortage where we're at. One of the counties we serve in has one therapist. And so if we were to grow organically with in-person services, we would be so shortly understaffed for the demand. So what we've done is we've hired virtual providers from throughout the United States, 14 states to be exact, to come and engage in care in our communities. We didn't want it to feel like a purchase service and something that was standalone. We want them to truly feel like they're a part of Geisinger and a part of this community.
Telepsychiatry has helped me do my job better because I'm able to reach patients where they're at. I see a lot of patients who otherwise wouldn't have access to care. For example, people who live in rural areas with limited access to things like transportation or time off from work, or limited ability to leave their homes because of things like physical disabilities or childcare reasons. And so it's really hard for patients under those circumstances to take the time to come to a clinic to get healthcare. So I'm able to meet them where they're at and deliver the type of care that they deserve and need, and I can do that through a virtual care. The feedback that I get from patients is that virtual care is really fantastic. It's really not much different from a regular psychiatry appointment, but for patients who have limited access to a hospital or a clinic, they're able to access care from the safety and comfort of their home or their work or their car, as long as it's parked, so they can access care where they otherwise might not be able to.
I think that providers are excited to work with Geisinger because we can offer a lot of different opportunities than just a traditional outpatient practice. So we have a lot of diversity in the ways that we practice. There are many different versions. We are able to work in telehealth, we're able to work in person, we're able to do both at the same time. We're able to see patients where they are. We're able to virtually get into their schools and get into their communities and do things that I don't think we could do in a traditional type of behavioral health practice. I think providers also like the ability to collaborate in a different kind of a way. We don't have the same hallways that we would in a traditional practice, and so we can get together virtually and we can make meetings happen where we talk about our patients. We can send each other messages and really understand what's going on in a different way. And I think it provides a different challenge to our workday that is invigorating at times.
So here at Geisinger, we collaborate mostly through virtual means with our team, and that's how we set our goals and then measure our successes with that. So we have the ability to meet with people from all over the country if need be. We integrate with our IT partners, we integrate with our clinical partners to come to the same goals and have the same and celebrate the success that we have.
We have providers that live in California or Georgia or Texas. How do they understand what it looks like in rural Pennsylvania? So we've actually taken the time and the opportunity to invite them in, and we're all visiting together. We're connecting and we're collaborating, and we're going to see the community. We're getting to see what it looks like in the offices. We're getting to see what it looks like to drive around town. And I think those are the ways that we're really going to be able to help our providers understand the people they're treating, even if they don't live in the community in which they're serving.
One of the things that Geisinger Department of Psychiatry and Behavioral Health offers is a multitude of educational and academic programs with the hope to train the future mental health clinicians for our patients. As the research will tell you, the rural areas and the underserved areas in the United States have a hard time recruiting quality mental health providers, which adds to the issues with access and the quality of care that the patients get. At Geisinger Department of Psychiatry, we have just started a residency program that will start in July of 2025, recruiting psychiatry residents from all over the country and the world. And in addition to other programs that we are very proud to have, such as our psychology internship and postdoc fellowship, our social work fellowship, and our addiction medicine fellowship.
Future's great with Geisinger. We've invested deeply in mental health services. We're opening a second 96-bed hospital in August this year that will bring for the first time child and adolescent care to central Pennsylvania. Currently, if you have a child in crisis, you're going to be sending them 3 hours away to Pittsburgh or Philly. But being able to bring child and adolescent psychiatry into our communities really fulfills the mission of our founder to bring these needed services to rural Pennsylvania.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.